Welcome to the Metabolic MD. Health means everything. We all seek optimal health, but most of us do not know how to achieve it. Dr. Paul Kolodzik has spent a career in the emergency department. Now, he helps his patients avoid ever ending up there. During these podcasts, you'll learn how you can lose weight and prevent and reverse disease through new technology, a modified diet, and the use of some new recently approved FDA medications. This information is not meant to be medical advice. Please seek consultation from your own medical provider. Let's listen in.
Well, Dr. Paul, guess what? We've made it through January. We've made it through February. Now we are on the footsteps of March. I can feel myself getting warmer. I feel myself happier. All kinds of good stuff.
What'd you do for your wife for Valentine's Day?
What did I do for my wife?
Yeah.
I got her an 8x10 picture of me for her desk.
You punished her.
Just me. A solo picture of me. So, all right. So, folks, welcome back to the Metabolic MD / CGM Doctor with Dr. Paul Kolodzik. I'm Terry O'Brien. Today, we are going to talk about something I've never heard of before, and it's to do with semaglutide GLP-1 and something you're calling microdosing.
Yes, microdosing.
Now, I've heard of microdosing with LSD.
Have you experienced that, Terry?
No, but I really want to try it. They did a 60 Minutes thing where they said it cures all kinds of depression and crazy stuff like that. So what is microdosing with GLP-1? How could that possibly work?
It's just small doses for limited periods of time, which, of course, is what I've been an advocate for. And the advantages it has are multiple. Number one, less risk of side effects.
Yep.
Number two, is you're likely to get off the medicine sooner without weight regain.
Yeah.
And number three, which matters these days, is cost.
Oh, absolutely.
You use lower doses, the cost of the medicine is less. So an example, if you're using 0.25 milligrams of semaglutide a month, that's a total of 1 milligram a month. So the cost to purchase that from the pharmacies that make it is going to be less, as opposed to if you're using, 2 milligrams every week, you're using 8 milligrams. It's, 8 times as much medicine. It's just going to be more expensive.
So is it the fact that they're coming out with pens with those dosages, or are these syringes?
No, this is one of the advantages of compounded semaglutide.
Yeah.
Because you can specifically dial in the right dose that you want for the patient, and so I think that's a good advantage.
So is this one of those fancy things? You went down to Florida, went to a metabolic conference, and now you're coming back with these cool little things. Is this what they were talking about down there?
Yeah, I mean, a limited number of people are doing this across the country, but I'll be honest with you, I've been doing it for the last 2 years just because I believe in terms of using medicine, less is more, and a lot of people can get by with lower doses of medicine. And I'll give you a dirty little secret out there, which is, and this happens in the addiction medicine world, it happens in the weight management world, is that some providers want to get, I'm just going to be honest, want to get patients on a medication that they're going to be dependent on for a long period of time. And in the addiction realm, a medicine called Suboxone for previous opiate addicts, which I think they should be tapered down and off of eventually. But with semaglutide, it can be higher doses and, just stay on the medicine for a long period of time. And then the provider has a patient and a source of revenue for a longer period of time.
So, okay, I'm going to ask another dirty little secret, and you can give me a dirty look if you want to. Do doctors make money by prescribing semaglutide?
Yes. I mean, you retain a patient and
Yeah.
you're providing a service.
Okay.
But the answer is, there's usually some margin on that medication.
I didn't know that.
If you're doing compounded medications,
Right.
if you're doing brand name medication, which is always the first option, because if the patient has access to brand name medications, that's what you want to do.
Right.
Then I mean, basically the doc gets paid for their time and their services.
So it's really more or less keeping them as a patient that's visiting you every month or two.
Yeah. Which, I mean, I'm at a point in my career where the goal is, seeing people get better. And, I mean, it's not that I'm super altruistic, though you know me, Terry. So
he just wants to be down here in the basement most of the time with me.
Yeah, but it's like, you want to keep the the person's long-term health in mind. And so this is kind of integrated with the approach I've taken with metabolic health well before the medications were out.
Yeah, you were talking about this years ago.
Yeah, which is well, let's get the lifestyle habit. Let's focus on the lifestyle habits, which is absolutely essential if you're microdosing, because you aren't going to have this big bolus of medicine that's going to completely suppress your hunger. If you're microdosing, you got to be doing the other lifestyle things that are necessary. And that's why I always think an initial evaluation, looking at, level of insulin resistance, doing a fasting insulin level, wearing a continuous glucose monitor for a couple weeks, getting a baseline, understanding exactly where you are, and then start working on the habits, which are, low carb, high protein diets, couple that high protein with strength training, essentially essential with using these medications because they'll cause some muscle loss as well. Some intermittent fasting, and then really then you've got a foundation, and you can add a little bit of medicine in there and still make good progress and not become dependent on the medication.
I remember when I went on it, because I'm a diabetic, they put me on it. It's probably been 5 years. It first came out. There was some, and I took it. I was sick. I was awful. I couldn't wait for this thing to wear off. It said it goes for a week, then you take another shot. I said, I ain't taking another shot. So by microdosing, my symptoms would be far less severe, you think?
Yeah, I mean, you can monitor the symptoms very closely. You can keep it at low doses. So microdosing, just so people know numbers that I'm talking about, for semaglutide, that would be 0.25 milligrams or up to 0.5 milligrams. Now, the highest dose of semaglutide is 2.4. So if you're at 0.25
That's
or 0.5,
10 times less.
yeah,
Less than the max.
less. The initial dose is 10 times less than the max dose. Yeah.
Wow, that is quite a bit difference, because I think they gave me the max right out of the door, and
I can't imagine that they would do that.
They did. I mean,
Yeah.
this was new stuff. My general doc, I was one of the first guys I think he tried it on.
Yeah.
And I said, I don't want to be on it.
Yeah. So I think, you can avoid the side effects. You can get the lifestyle habits down, which are going to be critical to your long-term health. And then you're also set up to get off the medication, because the way these medications work is they're titrated up over a period of time. That means the dose is increased. You're on the low dose for a month. And then if you're on a regular regimen, you're on the next highest dose. And then you go to the next highest dose. And then you go to the next highest dose. And then you go to the next highest dose. So you get all the way up here. Whereas if you just go if you stay at 0.25 low dose or 0.5, and that's the highest you go, then it's a lot easier to titrate down and get off.
But will they see results at that level?
Yeah, I have my patients have done great at that level. Now, not every patient, you can't, this does not apply to the category of patient that just wants to take a shot and not do anything else. But I have a selective population, because people that come to me know that that's not what they're going to get. They know we're going to be talking about blood glucose management and low carb diets and intermittent fasting and strength training. But long term, it's a very workable approach to losing weight and improving metabolic health, not just weight-related issues, but overall health, and then getting off the medication so you aren't becoming lifelong dependent on it.
So one thing I've never asked is, I know that sometimes these blended semaglutides, the generics, they're
compounded.
They're compounded with vitamin B to help with the nausea. Is that what it is?
That's correct, yeah.
And
B12.
Does that work pretty well?
It helps. I would say it helps. I don't think the B12 completely resolves the nausea.
Right.
At times. And the response people have is very variable, if I can say that, meaning some people will never experience any nausea at all, but some people will get pretty sick. Again, because I go slow and customize doses, I've always I've had people that have had very limited problems. In fact, I've had patients not uncommonly have nausea. I've had maybe...
You say that wears off?
It wears off, yeah. You take the shot, and after a few days, that starts resolving.
I just thought mine was getting better because the stuff was wearing off, and I didn't want to take that next shot.
Yeah. Yeah.
Or do you think my system was getting used to it and I could have taken the next shot?
I think the answer is both, because when you titrate these medicines up, it's that your body accommodates to the first dose so you can move to the second dose.
Yeah, okay.
But if you keep the doses low, the nausea is minimal. I think I've had maybe a couple patients progress from nausea to vomiting. The other thing I've seen occasionally is constipation. As well. But of course, with both those problems, a little bit of nausea or constipation, we have techniques, medications to deal with that.
Can we talk a little bit about the fact that this is like last year when we were talking about semaglutides, GLP-1s, it was hot. I mean, everywhere you get the news, the magazines, it all was all about this. It feels like that's died off quite a bit.
Is that right?
I'm in tune with this. I'm in tune with the modern society, Dr. Paul.
Is that right? Yeah. You're a Renaissance man.
Oh, I am.
Yeah.
So do you think maybe we hit that bubble and now it's just becoming uncommon
I
practice?
think some of the recent data has come out saying people don't want to stay on it forever. That for whatever reason, people, decide after a year, 10 months, a year and a half, that they want to get off the medication. So I think that's cooling down. In fact, it's even, from a financial standpoint, the fact that people are not going to be on this medicine or choose to be on, often don't choose to be on it forever, it's actually hit the stock price of a couple of these pharmaceutical companies.
Really?
Yeah, because, they have presented this as potentially a chronic treatment, just like if you're diabetic, you may need to be on insulin for the rest of your life.
Correct.
If you're obese, you may need to be on GLP-1 for the rest of your life. But it looks like people in general are choosing not to do it, which underscores once again the value of lower doses. So again, the theme is lower doses for limited periods of time that lead to limited side effects, lifestyle changes that are necessary, which I think people want to make anyways. They just sometimes
this
need
is just a Kickstarter.
Yeah, I have some middle-aged patients that they've gotten so big they have difficulty exercising. So they're looking for a reset, really. And, sometimes these medications can help provide that reset. And I think that can be valuable if it's done correctly, with not the intention of being on the medication for the rest of your life.
And the other thing I've seen, again, because I'm tapped into society and I'm monitoring these things, the price is are they coming out with different, is it brands or names for it where they're changing the price a little bit?
Yeah, so that's happening, that some of the brand name companies are offering a medication option without a pen.
So it's a syringe and a needle.
So it's like the compounded medicines. Yeah. And that lowers the cost of the medication. Right? See, almost in half it can lower the cost. So because the manufacturing process, when you aren't integrating a pen into that, is much less expensive. So yeah, and we're using all those options in my practice. So again, the goal is to try and get the people brand name medication when they have coverage for it, because the money is an issue. And that's always our preference. But again, sometimes we use the compounded medication if that's an option for people.
So I pulled out my insulin pen, which I carry in my pocket because I take 3 shots every day with breakfast, lunch, and dinner. And I know I'm being sarcastic in a way, but this cannot be worth $500, right? That little pen cannot cost. So somehow they're manipulating the price of these things just to get them into the market stream a little bit, right?
Yeah, I don't know. My bet is you don't pay $500 for it.
Hell no. Yeah. It's like what are those cards you go to the pharmacy and you show them this card and they get a magic discount?
The good RX cards.
Good.
Yeah.
Well, that's crap. Come on, you know that they're doing that so they can charge a lot to the hospitals.
Okay.
I know you don't want to go down that path. It's just a pet peeve of mine.
Yeah. So it's a process, and there's a lot of input points, like what kind of insulin is that? Is that one of the newer options of insulin that's still under patent?
You told me something a while back, which was crazy, and I didn't realize this. The long-term insulins are basically just normal insulin injected with some oil, so it doesn't go into your system as fast? Is that
Yeah, actually, I there are medications called depot medicines, DEPOT, where they're mixed with an oil, which makes them soluble over a period of months, or a period of a month or more often. I don't know. I'm just going to tell you, I don't know about insulin specifically, if that's how that's produced.
Yeah, I didn't know, because why does one last 24 hours and one only last?
Well, it could be the chemical structure too, but with some medications, last podcast we talked about Vivitrol, the long-acting medication to help with alcohol. That's an example of a medication that is mixed with oil so that it dissolves gradually out of your system or into your system over a period of a month, and that's why you only need a shot once a month. There's some, contraceptives that are utilized that way as well.
Well, I'm sorry to take us away from the microdosing thing, but I was going down the path. I had to go down the path.
Yeah.
So what else do we need to talk about this?
No,
microdosing?
just in summary, if people, so if you've been hesitant, if you're thinking about these medications, but you've been hesitant to go on, then first of all, I think not being the first to do it, being a little bit hesitant is a good thing. And I think a lot of people know deep down inside that they've got to make lifestyle changes as well. But microdosing may be an option to look into if that's what you're thinking about. Now, if you don't need medications, if you do what the majority of my patients have done for years with, let's focus on reversing insulin resistance, let's use continuous glucose monitors to guide diets, let's go low carb, high protein, get you strength training to reduce insulin resistance, then that's obviously preferable. But for people that feel that they need a little boost or they get into a stall, if you want to dip your toe into the waters of considering that medicine, then a microdosing approach is something that you should be asking your provider about.
And I know you're licensed in 4 states. So those 4 states are Arizona, Ohio, Indiana, and Florida, correct?
Arizona, Ohio, Indiana, Florida, right.
And are you still prescribing GLP-1s to some of those patients that are contacting you through metabolicmd.com?
Yeah. So again, metabolicmd.com is the medical practice. For patients in states that I'm not licensed in, we focus on helping people with the continuous glucose monitors I've mentioned, because they're now over the counter.
Right. And you're you're offering those through the CGM-Doctor.
Yeah, CGM-Doctor. I had to do a different website because the CGM-Doctor site is not medical practice,
right?
But we do offer CGM health coaching, so you can get CGMs there. You can, of course, I got to plug the book, the best-selling book on Amazon on CGMs.
That's right.
All right, and then we're offering CGM health coaching with some health coaches that I've worked with for years that are experts in interpreting CGM data and helping patients use their CGMs effectively.
But anybody out there who has a question about microdosing, and especially if they're in Ohio, Indiana, Florida, or Arizona, they can contact you and you can work with them on that microdose strategy.
Yeah, absolutely. I mean, that's what the majority. I have very few patients that are on higher doses.
Oh, that's great.
Yeah.
And if somebody's not in those states and they have questions, are you willing to entertain questions from other people?
Yeah, I mean, I can't provide medical care in states that I'm not licensed in.
Right.
But I, offer a lot of education on the website. I can have brief informal discussions that are not answering patient-specific questions.
Right.
Which I have done with some of the patients that have decided to use a CGM. So I'm happy to have informal discussions with people. There's even a mechanism on the website where you can schedule an informal discussion, but I got to be absolutely clear to people that's not medical care. I can't answer questions specific to your situation, but I can, for example, say to people that people in your situation in the past, I've looked at providing this kind of insight or that kind of insight.
So, for those listening, and again, our audience is growing all the time, if you're interested in a CGM, and a CGM is a great tool to understand how your body's processing carbs, sugar, things like that, CGM-Doctor is a website where you're actually you're providing or selling the Stello CGM, which is the leading
an over-the-counter
CGM.
CGM.
But what I love about the website is the fact that you have all these little small videos that tell people about specific topics on blood sugar control and things like that, as well as semaglutides and GLP-1. So it's a great place to go if you're looking for information about this stuff, and I recommend going there. And if you're really intrigued, I would say try a CGM.
Yeah, the phrase we use is CGMs are not for just diabetics anymore. So I've been using them for now about 7 years on non-diabetics. If you're middle-aged, overweight, if you have diabetes in your family, if your doctor's ever said, your blood sugar is a little bit high, we need to keep an eye on that. That's kind of code for you're either pre-diabetic or heading toward pre-diabetes. And that's the time where you can do something about it. And, a CGM with 24/7 visualization of what's going on with your blood sugar related to everything you eat, as the last chapter in the books says, can be life-changing.
Right.
Yeah.
So if you're CGM curious,
CGM curious, you just coined that phrase.
I did.
Didn't you?
I think it'll catch on. Check out the website. Any last words of wisdom before we sign off on this cast?
No, other than, again, consider baseline metabolic health and lifestyle changes that you have to make to begin with. And then if you want, again, look at considering a GLP-1, look at the microdosing option. But
if they're looking for that instant drop 40 pounds, that's not the way to do it.
You need to go to one of the internet sites and get a GLP-1 because that's what will happen, because that's a category. They'll be happy to give you medicine for as long as you want medicine.
Right.
It's just not the way we do things.
I think you're doing it the right way. Okay. Well, in that case, we'll sign off for this podcast. I'm Terry O'Brien, along with Dr. Paul Kolodzik. This has been the Metabolic MD /CGM Doctor. We'll see you guys soon.